My name is Dr. Buonassisi. I'm a facial plastic surgeon in Vancouver, British Columbia. I've been in practice for 20 years and I specialize in facial rejuvenation surgery. Our clinic offers a unique approach in that we offer both surgical and non-surgical facial rejuvenation options. This video is part of a series where we talk about periorbital rejuvenation, so brows and eyelids. And in this part, we're going to talk specifically about the brows. So what is a brow lift and who is it for? A brow lift essentially is a surgical procedure that allows the brow pad to be elevated. Now, of course, there are brow hairs that come along with it, but that's not really the main goal of the surgery. It's really to get the soft tissue pad to get back up onto the orbital rim or higher if we can. The shape of the actual brow hairs is something that patients do after the procedure to give it the specific shape that they want. But getting that brow pad up and off of the upper eyelid can be very rejuvenating. And that's the goal of either surgical procedures or, to a lesser extent, our non-surgical treatments. A candidate for a brow lift is a patient whose brow sits lower than it used to. So it's become ptotic or it's descended with age. Or in some cases, patients who have a downward turn to the outer brow that makes them look sad, or it just affects the attractiveness of the area around their eye. So some of our patients can be fairly young, and some of our patients are those that have had some age-related changes. The term candidate is something that we often use as surgeons, but what it really means is the surgical procedure going to be helpful? Is it going to look good? Are you safe to have it done? And I think there's lots of factors that come into play when we talk about whether someone's a candidate for something like a brow lift. For example, if someone has a very heavy brow and the brow tissues are stiff and they won't move, it's unlikely that surgery is going to give them much benefit. Also, somebody who has a very, very high forehead and doesn't want their forehead to become even higher might not be a good candidate for some of the brow lift elevation techniques. So there's lots of factors that we have to take into consideration. I generally feel as though the non-surgical techniques are, because they're more subtle, are likely more helpful in our younger patient population. And I think as our patients get a little bit older and if their brows are significantly loosened or droopy, usually the surgical procedures give them enough of a benefit that it's worthwhile pursuing that strategy. Being a candidate really for any surgery, particularly cosmetic surgeries, also means that a person has a reasonable expectation for what the surgery can achieve. It's not possible to make the brows exactly the same. It's not possible to have a very specific height to the brow. And as long as patients understand that the surgery does what it can in their particular situation, then I think that they have a reasonable understanding of that. The types of brow lifts in general are related to how far away from the brow the surgical procedure is initiated. So there are brow lifts that can be done up in the hair, at the hairline, in the middle of the forehead, and directly on the brow. And as you get closer and closer to the brow with the surgical approach, the more the brow can be lifted. So there's probably a happy medium in a lot of cases. We don't usually have to make the incision directly on the brow. We don't, I think you can get enough elevation from the other techniques, but sometimes the patients have a preference, and as I mentioned previously, the height of the hairline can have an impact on which surgical approach patients prefer. The technique I use for brow lift, it really is a negotiation. And I think that for some patients, they want to have the hairline maintained, so we don't have as an option an incision behind the hairline. In other cases, patients may have very thick or very obvious wrinkles in the forehead, which provide a great place to camouflage incisions. So it really depends on the person. I think that there's pros and cons to all of the approaches. There is usually one or two approaches that are probably ideal in a patient that I'll generally recommend. But in the end, they can decide which they prefer. Usually the procedure is performed under local anesthetic. I would consider this a very minimally invasive procedure. We're really just dealing with soft tissues. There's no bone work required. So in general, an incision is made somewhere between the brow and the temporal hairline. And skin is usually removed. Also, the skin is elevated from the underlying muscle so that it's mobile. And then the skin is elevated and closed with stitches. There's usually deep stitches that support the wound and superficial stitches which just gently bring the edges together. Recovery from these surgeries is usually pretty quick. I would say on average, within a week, people look pretty good. In general, the non-surgical treatments that can be combined with brow lift surgeries generally involve volumization, so volumization of the brow or the temporal area with fillers, relaxation of some of the muscles that cause wrinkles, so the muscles in the brow or the muscles around the corner of the eye can be relaxed. And then finally, laser resurfacing. So a brow lift can be performed and then the skin can be resurfaced subsequent to that. It can be done on the same day, or it can be done within a reasonable time frame afterwards as well. So as mentioned, this is part of a video series, and there's a video that we have of Amanda that documents her journey through an upper blepharoplasty and brow lift, which is a nice combination treatment.